Good afternoon, everybody. Good afternoon, and thank you for tuning in this afternoon as we have our daily time together where I have an opportunity to answer your questions and also provide the most up-to-date information about how we're dealing with the coronavirus crisis here in the state of Rhode Island. As a quick reminder, tomorrow's press conference will be at 2:30, so 2:30 tomorrow, and then we'll return at 1 o'clock on Thursday and 1 o'clock thereafter for every day. As you can see from the data displayed on your screens, or that will be displayed in a minute, the number of new cases and the number of hospitalizations and the number of ICU hospitalizations is holding steady. So we're really holding our own right now. Haven't really seen much of a decline, which is what we're aiming for, but also not an incline. So good job. Good job to everybody who is staying at home and wearing your face mask, keeping your contact tracing notebook, keeping 6 feet away from folks if you have to go to work, and just washing your hands constantly, really continuing to clamp down. It's clearly working, it's clearly saving lives, and I just want to emphasize to you, every day is important. We are learning a lot about this. We're learning how to live with the virus. We're learning how to deal with it. Every day really matters. We're in a fight to bring our infection rate way down. And right now, we're doing very well. But I can't emphasize enough to you how important it is that between now and May 8th, you really focus on obeying that stay-at-home order. Because if you do, I think I'll be able to lift the stay-at-home order May 9th. And that would be very exciting for all of us. You may have seen earlier today that Governor Baker of Massachusetts renewed the stay-at-home order until mid-May. I would really like to not have to do that here in Rhode Island, and that's going to depend on the people of Rhode Island staying hunkered down for the next couple of weeks, obeying the stay-at-home order. Our mobility, we're watching the mobility data, we're watching the crowds in stores, we're watching the traffic on the streets. We've seen a little bit of an uptick, and that's not what we want to see. Stay-at-home order remains in effect. Hang in there with us, obey the rules, and I hope, and I plan, on May 9th to be making the announcement that the stay-at-home order will expire. But I won't do it if we're not ready, which means we all need to stay hunkered down between now and then. Okay, a few items today. I want to spend a lot of time talking about health care. Obviously, this is a public health issue. Health care is top of mind for everybody. It's always important that we make sure that everybody has access to high-quality, affordable health care. That's doubly so now as we're dealing with the health care crisis. And it means we have to do everything we can to make sure that everybody has access to high-quality health care. Health care of all kinds, medical and behavioral health care. Just as a reminder, I had signed an executive order earlier this month mandating that health insurance companies cover telemedicine for all visits, for all primary care and all specialists, and that they cover it in the same way that they cover inpatient, in-office visits. That seems to be going very well. So thank you to providers who are changing the way you do business and embracing telehealth. And, big thank you to insurance companies who have really embraced this and done the right thing throughout this crisis as we work together to meet the healthcare needs of Rhode Islanders. Having said that, we need to do more. We need to do more to support our healthcare providers during the crisis. Almost every day I talk about our healthcare providers, doctors, nurses, nursing assistants, everyone out there who's in some way treating patients is having a hard time. No matter how you slice it, they are having a hard time. They are working every day. They are tired. Many of them are dealing with financial issues themselves and in their practices, and they're also dealing with the anxieties that they see in their sick patients every day. So as a result, I have decided to take additional action. Yesterday, I signed an executive order that will allow burdensome regulations to be relaxed, which could be standing in the way of patients accessing the care that they need in this crisis. We want to do everything we can to make sure that people, patients, Rhode Islanders, can have access to the health care that they need when they need it, and that our health care providers at this time don't have to jump through hoops and any excessive red tape or bureaucracy with insurance companies to be able to provide the care that they know their patients need. So as a result, I've signed an executive order which is in effect in the state of Rhode Island until May 27th, which is designed to clear the way for patients to get access to care and to make it a bit easier for providers to provide the care that they know is necessary for patients, as I say, without having to go through red tape, so that they can frankly focus all their time taking care of their patients. So the following are in effect until May 27th. Number one, I want all patients to know, all Rhode Islanders to know, that their out-of-pocket costs for prescriptions will not increase during this time, and that the medicine you are taking now cannot and will not be dropped from coverage. So from now until May 27th, insurers cannot make changes to what drugs they will cover unless the changes benefit their patient and the doctor says that that's what's necessary. Secondly, I want to make a note about provider referrals. We all know what a burden it is for primary care doctors to provide a specific referral to a patient so that patient can go see a specialist to receive specialty care. As a result of the EO, insurers are going to have to relax this process to allow much more time and leniency. So there will be no referrals needed for telehealth, which is currently a major source of community care delivery in the state. So again, as a note to primary care physicians, to specialists, and to the people of Rhode Island, on account of this executive order, I am requiring insurance companies to be a bit more lenient in their requirements as it relates to getting a referral to a specialist from your primary care provider, just throughout this period. Additionally, I want to make a note about pre-authorization. Pre-authorization is often required by insurance companies if a provider wants to perform a particular test or perform some procedure. They have to get what's called pre-authorization from the insurance company. It's well-intended practice designed to keep costs down, but frankly, it's also a great burden for physicians, and these physicians need our attention now to help lift those burdens and lift the red tape. And I don't think at this time healthcare should be delayed because of a need to get prior authorization from a patient's insurer. Right now, we need to be in the business of providing healthcare and speeding the delivery of healthcare. So I have ordered in this executive order that inpatient hospital and rehabilitation, long-term care, and telemedicine in-network services not be suspended because someone doesn't have prior authorization. Additionally, there'll be no prior authorization required for testing and treatment of COVID-19. Behavioral health care. As I say every day, this virus is taking a toll on all of us, and being able to seek mental and behavioral health care is just as important as physical health care. And we have to make sure Rhode Islanders are obviously able to deal with their anxiety, depression, substance use disorders, along with any other mental health needs that they have as they're coping with the crisis. So at this time, due to this executive order, in-network behavioral health provided need to be trusted to provide the care their patients need without being second-guessed. No referrals or other benefit review approvals will be needed for a patient to access needed mental and behavioral health care. So the executive order is available. Marie Ganem, who's the Health Insurance Commissioner, will be providing full detail to providers and to insurers, but I wanted to give the public a flavor of this. I hope if you are a physician or a provider, this allows you to breathe a sigh of relief, knowing that you can continue to do your job with a little bit less burden. And if you are a patient, I want you to breathe a sigh of relief, knowing that basically during this time, your network can't be changed, your coverage can't be changed, and you're not going to be hassled because you're told you have to wait for pre-authorization before you can get the health care you need. To insurance companies, I know this is a disruption to your business model. Many of you have been in contact already with our insurance commissioner and with my administration. You've been incredibly cooperative. You've helped me to draft the executive order, and I just want to say thank you. From day one, you've been terrific, and I want to say thank you to you for helping to partner with us and get through this crisis. Everything I just said lasts until May 27th. I will renew it if I feel it's necessary at the end of next month. Okay, I want to make a couple of more notes. One relates to our technology. So one of our work streams is around technology. We know we're going to have to rely additionally on technology in order to help us get through the crisis, in order to help us with contact tracing, symptom monitoring, ordering of appointments to get a test, et cetera. You know, we have to rely on new kinds of technologies, and as a result, we have built a number of public-private partnerships reaching out to companies to help provide us with the technology that we need. One of those partnerships is with a software company called SurveyMonkey. A few weeks ago, you recall I talked about our partnership with a software company called Salesforce. And that, on account of the work with Salesforce, we now have state-of-the-art software for compiling all of the contacts we trace and enabling the Department of Health and the National Guard to have immediate access to that information. Contact tracing is one piece of the puzzle. Once we have contact with an individual who's tested positive or who's in quarantine or who's been with has had exposure to someone who's positive, we need to know how they're doing. What are their symptoms? So in addition to contact tracing, we're doing symptom tracking and symptom monitoring. We need to understand who's sick, how long are their symptoms lasting, what are their symptoms, how severe are their symptoms, when have people recovered. That's where SurveyMonkey fits in. So SurveyMonkey's keeping in contact with all of the individuals in our contact tracing system by text several times a day in order to see how they're doing. What are the symptoms? How are they changing, et cetera. That information is going to be sent to the Department of Health on an aggregate level so that the Department of Health over time can better understand the disease. We can better understand, what are the symptoms? Are there certain symptoms of certain populations, hotspots of symptoms? Over time, as we have more data on our entire population, we'll even be able to predict if we see a spike in symptoms in a particular area of particular population. So huge thank you to our tech team. It's amazing how quickly they're moving. I want to remind everyone in Rhode Island, this is opt-in only. No one's going to force you to interact with SurveyMonkey. Having said that, I would encourage you to do it. SurveyMonkey won't have your data. The data is going right to the Department of Health in aggregate. I'm going to be talking a lot about this in the weeks and months to come. The name of the game here is data. And over time, we would love to know what's going on statewide around these symptoms. So we're going to be interacting with you several times a day, collecting all that data. That data is going to be like gold for us who are trying to manage the crisis, especially after the economy opens, so we can better understand it. So I would just say, if you're contacted by SurveyMonkey, you're going to be given the option to opt in, and I'm urging you to opt in. I'm urging you to say yes, take the surveys. It'll help us keep you healthy and your family healthy and your workplace healthy and get everybody back to work and keep everybody safe. I want to make a note about the DMV. It's coming up a lot, so I'd like to talk about it for a second. So previously, I had announced 90-day extensions for anyone with expirations in the months of March and April. And I'd like to say now that we're also giving 90-day extensions for all expirations that come up in the month of May. So if your expiration date was originally in May, you'll now have until August. This applies to licenses, registrations, inspections, permits, and temporary plates. I also want to take an opportunity to remind everyone that the DMV in Cranston is open, but by appointment only. Do not show up at the DMV in Cranston unless you have an appointment. All field offices besides Cranston are closed, and I would ask that you only make an appointment if you absolutely need to. As I just said, everything that's come up in March, April, and May is extended for 3 months. Nearly everything you need to do, you can do online. We've actually put more things online through this crisis, so I'd encourage you to do it online if you need to. And then if you need to go into the DMV, I understand that, make an appointment, go in and follow all the social distancing rules. As I talk about the DMV, I'm sure I'm generating a lot of questions in your minds around what about town halls, what about field offices for DHS, what about the rest of state government? I will be back to you either later this week or the beginning of next week with some broader guidance on how we plan to handle the rest of government services. So if you could hold down a bit for that further guidance. And today, I did want to provide some information about DMV because May is around the corner and we're getting a lot of questions. I'd like to end with some good news as it relates to PPE. As I've said, the most encouraging thing to me throughout this crisis has just been the way people have pulled together. Not a day goes by that someone doesn't do something extraordinarily generous or kind or proactive to help us out as we deal with the crisis. And I mean not a day. I am constantly overwhelmed by people's kindness and generosity as it relates to us and as it relates to taking care of neighbors. So to that point, you may recall that about a week ago, I indicated that we were quite concerned about where we were with our gowns. We talk a lot about N95 masks and surgical masks, but the truth of it is full PPE, full personal protective equipment, is actually a number of different pieces of equipment that we are constantly trying to supply. And right now, all over the country, one piece that's in great demand and short supply are gowns. And at the end of last week, we were in not a great place as it related to gowns. And I was calling FEMA, and our team was working like crazy, but it was getting to a shortage. Enter Charlie and Owen Merrow. Charlie and Owen Merrow are heroes in my mind. They own and run Merrow Sewing Machine Company. Merrow Sewing Machine Company is in Fall River, but Charlie and Owen live in Rhode Island. We were put in touch with the company some time ago through Polaris, which is a Rhode Island-based nonprofit that works with manufacturers. And God bless the Merrow Sewing Machine Company, because just when we weren't sure how we were going to get the gowns we needed to get through the next few weeks, Charlie showed up with a gown that they made with certain specifications. After a lot of testing, he showed up over the weekend with more than 3,000 gowns made right across the line in Fall River. And even better than that, we've now ordered more than 500,000 additional gowns from that company, and we expect that that supply is going to hold us in good stead for months to come. So I have said to you many times that we are literally scouring the earth for PPE, and that's true, we are all over the world, but we're also looking right here in our own backyard. And so thank you to Charlie and Owen for stepping up when we needed you most. Your product is fantastic, and we needed every bit of the 3,000, and we need every bit of the 500,000. So thank you, and for everyone in Rhode Island, know that these guys stepped up when we needed them. So I will turn it over to Nicole and then come back for questions.
Thank you, Governor. Good afternoon, everyone. As always, thank all of you for tuning in and for helping us get out accurate information when it comes to COVID-19. And I also want to echo that thank you to our manufacturers who are looking to help all of our healthcare workers who are Rhode Island's unsung heroes on the front lines. Now, because of their effort, the healthcare workers who are actually caring for COVID-19 patients who have COVID-19 virus actually will have the gowns that they need to be able to wear the full PPE in those specific situations needed. So that's important. We want to continue to make sure that our healthcare workers on the front lines know how valuable they are and that they have the equipment they need to do the work necessary. So to jump in, as the governor may have said, we have 218 new cases. Of our COVID-19 patients, 266 are currently hospitalized. Of those 266 people, 84 are currently in intensive care units, and 55 of those 84 are on ventilators. We unfortunately have 6 new COVID-19 associated fatalities. These people range in age from their 50s to their 90s. And our thoughts and prayers go out to the families of these people and to the families of everyone who have sadly passed away over the course of the last several weeks. We certainly understand that that has not been easy. To share a little bit more, of these 6 people, 5 of them lived in nursing homes, and 1 person lived in another congregate living setting. We are going to need to continue to be very vigilant in nursing homes, other congregate settings, and hospitals when it comes to all of the approaches that we are taking. That includes the visitor policies, that includes screening of staff persons as well, and it includes wearing the masks that the governor has required for healthcare workers and staff workers taking care of patients in nursing homes and in hospitals. People in congregate living settings, like nursing homes, tend to be more medically fragile, and just living in a congregate care setting places such people at higher risk. That means the virus has an easier ability to spread because people are living closer together, and it's a population that is more medically and physically fragile. However, an important piece of context is that we are announcing newly confirmed COVID-19 associated fatalities when I talk about the numbers each day. This is the national reporting definition, and it's how CDC collects and shares COVID-19 data. For many people who pass away, COVID-19, along with other factors, are often involved. For some people, underlying medical conditions are actually in play. And for all of us, our immune system ages with us. Our immune system is the system that allows us to fight off infections. That means that as our immune system function declines, so does time. As someone ages, their immune system can decline. This is part of why people in nursing home communities may be at an increased risk of infection with COVID-19. I share this context because I want people to understand that assisted living and nursing home staff and administrators and those working in those facilities are all working very hard to keep the residents in their care safe. The same goes for all the healthcare workers and other staff who are in individuals' homes through home health agencies. They love the people in their communities, and this has been an enormously challenging time for all of them. They are doing everything they can to keep people safe. For example, they're working with us to ensure that the testing that we said is needed to continue to do cyclically, repeatedly, in these settings is happening. We are working to get all residents and staff in all homes tested. There's a tremendous effort to do that so that we can better understand the landscape in these congregate care settings. Testing is one of the key focal points for us in preventing transmission of COVID-19. We know that expanded testing in other high-risk environments outside of congregate care settings is also important. We have our eyes laser focused on being able to expand testing in our communities that have been disproportionately impacted. The governor shared some of the walkthrough sites that are occurring. We know for the immediate time frame and for the long-term future, it's going to be important for us to have an expanded testing system that allows us to better understand what we need to do in the communities at highest risk. Because testing is most accurate with symptoms, when testing goes beyond that, it must be guided by public health in determining the best way to do it and how to have the interpretations best understood. As we've shared, we want this process of reopening the economy to be science-driven. We want to minimize mishaps or misinterpretations and help everyone understand what we need to about testing when we are doing it in specific populations and groups. We know that testing is just one point in time. Someone could get tested today, have a result, and then have a different result or outcome the next day if they were exposed to someone. That type of understanding is why public health guidance is important as we move forward. It's also helpful to know that there are several measures with testing, which is one tool in the toolbox, that we are focused on to make sure that everyone stays safe as we're reopening the economy. The governor shared about the importance of contact tracing. We want to have expanded testing so that we can engage in the expanded contact tracing system. That's important, very nicely and importantly supported by technology, as has been shared. We also need to continue the services for quarantining and isolation, because that, as we know, is the key for helping to stop transmission of this virus. And we also need to continue taking the personal protection measures that we continue to discuss. that allows me to reiterate the stay-at-home order continues to be in place. That's what's going to allow us to move forward. We all need to continue avoiding groups of more than 5 people, continue to wear cloth-based coverings when in public, continue to wash your hands multiple times through the day, and continue to keep a distance of at least 6 feet from each other whenever possible. Those are the core principles we have to being able to stop transmission of this virus and to continue to keep Rhode Island ahead of this as we get through it together. With that, I'm going to stop and open up for questions.
Good afternoon.
Hello.
Governor will kick off today's briefing with a question from Steve Alquist of Uprise RI. Representative Anastasia Williams sent you an open letter calling for more representation of communities of color on elected and selected bodies tasked with preparing communities for the impact of COVID-19 and future resurgences. Thoughts on this?
Yeah, I haven't seen the letter, but it's a good idea, so I'll have a look at it for sure.
Bill Bartholomew asks for the doctor. Are you and the Department of Health the primary voice that will determine whether Rhode Island can proceed with Phase 1 in May, or are economic factors being given equal weight?
It is a combination. Public health is a core driver to how we're moving forward. But it's important to understand public health includes society's economic health. If someone is going to remain healthy within their community, they need to have access to a job, they need to have access to finances to be able to obtain good nutrition. All of that plays a role. So we have a very thoughtful team and strategic approach that's driven by public health and absolutely takes into account the economic factors involved.
Sure.
I would like to address that for a minute as well. I think it's a very important question, and you see it playing out in Washington and all over the country in different states. So let me share with you a bit of detail about how it's happening. We have a team of people called a Community Mitigation Team, led by people at the Department of Health and in consultation with other epidemiologists and public health experts at Brown, Johns Hopkins, other places. They form the basis of the science and the recommendations. Then that group informs everything else. We have like a new normal working group and a school working group, and we rely completely and heavily on that. So I just think it's important that people know that. It's also important, our guiding principle through this is there is a relationship between economic health and physical health. It is much harder to maintain your physical health if your economic health is so compromised. So while I will never do anything in aid of our economy that our public health experts think is dangerous, but it is also important to realize that there is a balance here. And when you have 170,000 people filing in our small state for unemployment insurance, that's a lot of economic pain, which could spill over into health suffering. And so, it's a balance. I'm not going to say this is easy. This is a judgment call every day, and it's a balance. And together as a team, we're trying to do the right thing for Rhode Island.
Our next question is from Michelle Smith of the AP. The plan you released to reopen Rhode Island contains no specific testing benchmarks. Why? How many daily tests must be done, and what should the positivity rate be before it's safe to lift the stay-at-home order and reach the other phases?
So, a couple things. First, as I said yesterday was a high-level overview, an outline, if you will, because I just wanted to begin the discussion and give people time over the next 2 weeks to digest how we're thinking about it. We're going to be coming back with more details. Secondly, we think of it as what I said yesterday. We have to be doing enough tests so that every symptomatic person can get a test within 24 hours. So it's not that we're trying to do how many daily tests to be done. The answer to that, what we're trying to do is everyone who needs a test can get one within a day, period. Secondly, we want to make sure that we have an excellent system for testing everybody in communal living situations, nursing homes, DD homes, group homes, et cetera. So we have to have a mobile testing set of metrics. We're not quite there yet. We need to do that. But the question left, so I forgot the rest of it. But the point is, as it relates to contact tracing, we want to make sure we do the case investigation within 24 to 48 hours every time. So it's as much about speed and making sure the population is covered and no vulnerable communities are left out, as it is around how many people per day. At least that's how we're thinking about it right now.
Barbara Morris from NBC 10 News has a question. Some medical offices have begun to offer antibody tests to the public. They say the tests are not FDA approved. What should the public know about these tests?
Thank you for that question. And with credit to the governor, that's one of the exact reasons why the COVID-19 Testing and Validation Task Force was activated. We have nationally and internationally renowned experts and scientists here in Rhode Island who are coming together to help get in front of the information being learned about antibody tests, and to be able to provide that information to the public, to the clinicians, and to businesses, so that we can all be best informed with which tests are the most accurate, how we should use them, and what approaches we should be taking with going forward. So we're thrilled, and thank you again to the co-chairs, Dr. Caliendo and Dr. Curtis, because that's exactly what this task force will be focused on providing for the public and for others throughout the state.
Our next question is from Alex Weldon of WPRO. Reportedly, the state assistance for hazard pay for nursing home employees making under $20 an hour is a loan. What are the terms, and how do cash-strapped nursing homes afford a loan versus a grant, especially when most don't have the money to advance for a week or month to meet payroll increases?
Mm-hmm. Good question. It is being structured as a loan, but it's a forgivable loan if the nursing homes use all of the money to augment the wages of their lowest paid employees. So the mechanism that we decided would be easiest to administer, and frankly the quickest way for us to get money into the hands of the hardworking people who need it, was to set it up as a loan. The nursing home or group home applies for the loan. They're advanced the cash. If the loan is spent in accordance with the regulations, and the primary regulation is that it all has to be spent to give raises of a certain amount to low-wage workers, then that loan will be forgivable.
Our next question is from Brian Crandall of NBC 10 News. What would you say to restaurant owners who don't know if their business can survive with significantly reducing seating capacity when they're finally able to reopen?
Yeah, so I would say my heart goes out to you, and we're going to do everything we can to get you through it. I'm hearing it, by the way, it's not just in Rhode Island. Restaurants across the country, it's a thin margin business, and being out of business for a month or two is not a small deal. So we're gonna, having said that, I can't do something that I think is gonna land Rhode Island back in the soup of a COVID surge. So we're gonna be smart, and we're gonna be effective. We're gonna work with you, but we may need to give you additional support, and we're wide open to doing that. I'm very well aware of it. And we're going to listen to you the whole way through, and if that means figuring out special ways to support certain industries like restaurants that are especially hard hurt, then we're going to find a way to do that.
The next question is from Richard Asanoff of Convergence RI. This may be for Director Smiley. What plans are there for the state to switch from its Cobol-based legacy system to a cloud platform, as was recently done with the DLT's response to unemployment claims?
Thank you, Richard. Yes, the state's IT systems have been something we've been working on for a long time, and I'm glad that Richard brings up the point about DLT. One of the great successes in the midst of this terrible crisis was what the Department of Labor and Training was able to do around the Pandemic Unemployment Assistance, the PUA program. And we were, as far as we can tell, the first or amongst the first in the country to be able to roll that out through a new system that was put together very quickly, although properly, and as a result of the strong team at Do It, at the IT department. We're looking at other opportunities. Frankly, the only way we're able to have almost 2,300 state employees telework at the moment is because of some of the IT upgrades that we've made over the last couple of years. We have virtual call centers happening with state employees working from home. We have hundreds of devices out where people can VPN into their desktop. And so we've made great strides, but there's more work to be done. And we are looking for other opportunities to drag government into the 21st century. And this crisis has given us an opportunity to make some of those changes.
Thank you. Eli Sherman has the next question. Health Department data shows everyone who has been hospitalized is either still in the hospital or has been discharged. Does that mean that no deaths have happened in hospitals? And where are deaths happening otherwise besides nursing homes?
There have been a few deaths that have occurred in hospitals, unfortunately, but the number is small. What we are presenting with hospitalized data is currently hospitalized. Some of the unfortunate deaths from hospitals may be included in the cumulative total number of people ever hospitalized data. The places where deaths are otherwise happening is, in the locations where people are, whether the congregate setting or occasionally at home as well.
Our next question is for the governor from Amanda Milkovits of the Boston Globe. Governor, you talk about possibly lifting the stay-at-home order, but there are refrigerated trucks at the medical examiners. Why are they there? Is this a contradiction?
Okay, I'm going to let her, but then it's addressed to me, so I'll come back.
As preparation for our response, we do have some refrigerated trucks at the medical examiners, not to be used right now because we have plenty of capacity at the medical examiners, but with credit to an excellent team that prepared for the surge, we have locations in place if needed for the future. Sometimes funeral homes may need additional assistance or other morgues and locations, and so that's in place to be prepared if needed. It is not being used, and it's all part of our overall preparation, reminding the governor's statement of prepare for the worst, but work for the best. So that's what we are doing.
No, I mean, that's exactly right. I would say, to answer Amanda's question, just because we may reopen the economy and lift the stay-at-home order doesn't mean people are going to stop getting sick. In fact, more people may get sick, but we have a healthcare system that is ready. We have a symptom tracking system and a contact tracing system. We now have places to live for people for free who are in quarantine, ways to isolate folks who are housing unstable. I mean, we will be living with this crisis, with this virus, with its sicknesses, with its hospitalizations for the next year. And we're all going to have to get comfortable with that. What we don't want to have happen, again, is an uncontrollable surge that overtakes our system. And I'm not going to let us go back to work until I'm confident that that won't happen. And we have systems in place that if we do start to see a surge, we know ahead of time and we can pull back appropriately.
This next question is from Ian Donis. Rhode Island has never had a person of color as a state Supreme Court justice. Will you commit to nominating a person of color for the pending vacancy?
I will not make that commitment, although I have a strong record of diversifying the judiciary in my tenure as governor, and I always will look at a highly qualified person of any race, of any gender, and I would encourage folks to apply. As you know, I pick from a list before me, and we've worked very hard to make sure that women and people of color apply, and I would love nothing more than to continue to diversify the court, including the Supreme Court.
Our next question is from Alan Gabberty of WBOB. What is the current status at the Rhode Island Veterans Home, and is there any plan to relocate positive or negative residents? How many residents have tested positive, and what are their ages? Have any been hospitalized? Continues on, how many residents are now in quarantine, and how many staff members have tested positive? And I can repeat these if you want.
Thank you. So we continue to have a very comprehensive and aggressive approach with our infection control and response at the vet's home, as we have been doing with our congregate care settings. A reminder is we had one patient identified as positive due to symptoms, and that led to the comprehensive approach that included, but was not limited to, testing all of the residents and all of the staff so that we could have a clear understanding of the landscape in that congregate care setting. So we have had 12 residents total who have tested positive. 11 of them do not have symptoms. There's only the initial one who was hospitalized, and that is out of 180 residents that are present. That allows us to better understand who has positive carriage, we say, who may have been exposed but is not demonstrating symptoms, and how we can care for them together. So our work is being done to help bring the people who have COVID-19 diagnosed through testing, even though they don't have symptoms, bring them together so that they can be cared for in one or a couple of units. We also have done the same for staff, and there are 11 direct care staff who are positive and 6 additional staff who are positives, for example, being housekeepers or folks who are doing important work to help ensure that the home is clean. So that information allows us to make sure that those staff are able to stay home and to isolate effectively there. And we can work very closely with the staff who remain to ensure all staff, which we had determined several weeks ago, continues to wear the masks that they need, continues to be socially distant as much as they can, and continues to have access to frequent hand washing and hand sanitizer to keep themselves and the patients they're caring for safe. We're also looking into ways to help ensure that staff persons stay to one area where they are. As I've talked about, one of the approaches in our congregate settings being limiting the different types of people that come in contact with the residents. So having this information in this environment allows us to do that more effectively.
And our last question today is from Patrick Anderson of the Providence Journal. The number of people tested has dipped in recent days. Do you know why that is, and whether it reflects fewer people experiencing symptoms?
We are not at the point of thinking yet that there are fewer people experiencing symptoms, but do anticipate that consideration in the future. Nonetheless, we want to continue with the expanded testing approach. When we are reporting test results, we are reporting the results, which is usually a day or two after the test has been obtained. And over the weekend, because of some challenging weather, there were fewer tests that were done on Sunday, which resulted yesterday, and that's what we are reporting today. So those types of changes can occur, but we want to continue the aggressive expanded testing strategy that I've been sharing and the governor has, including all of our high-risk populations that we'll continue to focus on.
Thank you very much.